webinar. Sorry about that. What we know, BGMN discusses sex now survey results among Black same-gender loving men. My name is Michael Kwag, and I'm the Director of Knowledge Exchange and Policy Development at the Community-Based Research Center. I'd like to acknowledge that today I'm participating from the traditional territories of the Wendat, the Anishinaabe, the Haudenosaunee, the Chippewa, Métis, and the Mississaugas of the Credit First Nation, also known as Toronto. We at CBRC are privileged to be able to live, work, and organize on the traditional and stolen lands that have been cared for by many Indigenous nations across Turtle Island, the lands now known as Canada. Thank you everyone for joining us today for today's webinar. I'm really looking forward to our discussion, and we'll be presenting some slides later on about CBRC and the Sex Now survey. But first, I'd like to introduce the moderator for the webinar, Robert Alsberry from the BGMN. Robert, whose pronouns are he and him, brings lived experience as a gay man, as a Black gay man, and his passion for health equity, which informs all of his work. This includes his work as a registered nurse, a steering committee member of the BGMN, a KD board member, and a facilitator for K1, an Ottawa-based Black queer men's discussion group. Welcome, Robert, and thank you for moderating today's session.
Thank you, Michael, for the warm introduction, and it's such a pleasure to be here with you. And as Michael said, yeah, Robert, he, him, and it's such a pleasure and honor to be here with this panel and to be here with the CBRC, who were so great in supporting this webinar coming together. And yeah, so as part of the agenda that we'll move into the next slide, Michael kind of already took care of the first piece, which is intro, housekeeping, and CBRC's land acknowledgement. I as well will be doing an introduction to the BGMN about our history and how we got to where we're at. Then we will turn the stage back over to the CBRC, who are going to talk about their work, how the Sex Now data came together, which is the data that we'll be referring to in our panel discussion. Then, of course, we'll get into the bread and butter, why everyone's here, talking about what we know as Black gay men, bringing our professional and personal lived experience into the data that CBRC has graciously put together for us. And then, of course, we hope to have some time for Q&A. So first and foremost, what I'd like to do is start off with BGMN's land acknowledgement to make sure that we take up time and space to acknowledge the rightful bearers of this land. So I'm just going to read this verbatim, which is the BGMN of Ontario, or the Black Gay Men's Network of Ontario, acknowledges that its members live and work on Turtle Island, which is the ancestral home of First Nations, Inuit, Métis, and multiple Indigenous tribes and groups. Whether land is ceded or unceded, their lives and culture are under continual threat by colonization and white supremacy. As an organization, we understand how these same forces continue to impact those of the African diaspora in Canada. The harmful effects felt from the enslavement of African peoples, disruption and forced migration from our native homelands, and present-day state violence all negatively impact ACB people, or African, Caribbean, and Black people in Ontario, this country, and globally. We stand in solidarity with our Indigenous family as we work to address systemic prejudices that keep us from living our best self-actualized lives. So now that we've been grounded into the land, we've gone over the agenda. What I like to do is just get into a little bit about the history of BGMN. So before we get into what we know, we're going to kind of address how we got to where we're at. So how the BGMN came into development, how the CBRC came in development, and how we got to information from the Sex Now. So without further ado, we're going to share a short video about the BGMN's work.
The Black Gay Men's Network of Ontario is a centralized hub for same-gender loving men of African, African diaspora, Afro-Latino, Caribbean, and Black identities. Our goal is to provide cultural, intergenerational mentorship opportunities, leadership, self-development, and empowerment, as well as activism support aimed at improving the lives of Black queer people in Ontario. Our key areas of focus are culture and knowledge production, sexual health and pleasure, substance use, and mentoring. Please go to our website for up-to-date content, blogs, newsletters, features and profiles of community members, newsletter information, gallery photos, as well as videos and images of our past and upcoming events. You can follow our social media at BGMN Ontario. We hope for your support, and we are thankful for the support of our allies and community organizations.
That video always makes me smile, and it's really great that we have such a media product to share with folks about our present work. But of course, that present work came from a lot of history. So I just want to briefly explain that the BGMN, like a lot of Black queer activism that's been taking place in Canada, goes back deeply. And so we can trace our roots back to 2010, where there was the Ontario African, Caribbean, and Black Gay Men Summit, Cultures of Sexuality in Black Men's Health. So at that time, there was approximately 120 participants, Black, gay, and other same gender-loving men who met and came up with a great document narrating their own health and wellness needs. However, there was a stall in that work, and thanks to the leadership of the GMSH ACHO based in Toronto and Black Cap, under their stewardship, and as well as some other great Black leaders, we were able to reconvene in 2018 and again in 2019, where we held the African, Caribbean, and Black same gender loving dialogue meetings. And once again, we were able to pick up that momentum, narrate our own health needs in terms of what health and wellness needs specific that we have, and in ways in which we can culturally competent reach those. So starting in 2019, we were able to identify some funds, create a steering committee, and that's what led to our contemporary work today as the Black Gay Men's Network. So we move into our next slide. I would be amiss without sharing this beautiful artwork that was done by Oluseyi, who's a Nigerian Toronto-based artist. So he was present during our 2019 dialogues. And this is a visual representation of the conversations that we were having amongst ourselves as ACB or Black same gender loving men. So in them, you'll note this image of this beautiful Black gay man, and around his body are themes that were really important to us: mental health and addiction, holistic health and wellness, mentorship and community, arts and culture, compassion and understanding, sexual health and pleasure. And what's probably maybe too small to note, but you'll notice in this left outer arm, there's a red plus sign, and that's indicative of HIV. We, as Black gay men, understand that HIV is part of our lives, but we really wanted to narrate our own health and needs without strictly the lens of HIV that sometimes takes over our experiences. And so from those themes, when you move into our next slide, that's how we developed our 4 main pillars that we talked about in our initial video. And so this is kind of our future and what we're hoping to build up for steering committees around these 4 main themes so that we continue leadership in these areas, which include culture, knowledge production, sexual health and pleasure, substance use, and mentoring. And based on today's discussion, we're really going to look at sexual health and pleasure and substance use in relation to the information from the CBRC. So that kind of answers the how about BGMN, how we got to where we are now, how we got to today's webinar with the CBRC. And then when you move into our next slide, that kind of leads us to the topic of what we know. And so what we mean by that is we know that there's inherent issues with research and that it needs improvement. We know that there's not enough race-based data in Canada. We know that there's not enough intersectional data. We know how white supremacy is embedded in institutions of research that often leaves Black people traumatized and not always willing to be participants. But on the same token, we also know that reviewing current data helps us continue to narrate our own health and wellness needs. And from the Black gay men's perspective, really informs the work that we want to do. So while we definitely want to acknowledge and hold space for the areas that research needs improved. The purpose of today's discussion is to really have a focused discussion on available data. What do we know about Black gay men? We know it's not enough research, but we know that there's some, and this enters CBRC. So I'm going to hand the stage back to Michael, who's going to give us a brief history about the CBRC. He's going to tell us about Sex Now, how that data came together. And then we'll move further into discussion. So without further ado, Michael.
Thank you so much, Robert. And as he mentioned, I've got a few slides just to give a bit of background about CBRC and the Sex Now survey. So who are we? Community-Based Research Center promotes the health of gay, bisexual, trans, two-spirit, and queer men, GBT2Q, through research and intervention development. Our core pillars aim to position the organization as a thought leader, working to transform ideas into actions that make a difference in our communities. So the first core pillar is community-led research. And I think that's principally our Sex Now survey, which will be going through some of the results today. It also includes some of our emerging 2S LGBTQIA+ qualitative and quantitative studies, such as our upcoming Canada-wide survey on COVID-19, as well as a chronic health study. Our second core pillar is knowledge exchange, which includes our annual knowledge exchange and capacity building conference, the summit, which this year is being held virtually on October 27th to the 29th. It also includes doing a bunch of knowledge exchange related work through reports, blogs, other knowledge exchange or mobilization content centering GBT2Q and 2S LGBTQI+ health on cbrc.net, our website. The third pillar is network building. So that includes things like our Pan-Canadian Advanced Community Alliance that we're privileged to work with Health Initiative for Men, AIDS Community of Toronto, Réseau, and Max Ottawa. It also includes our provincial and regional networks across Canada that engage various local and regional organizations and groups that are working to support our communities. And the last core pillar is leadership development, which includes some of our better known programs called Totally Outright and Investigators. More recently, we've also developed some 2S LGBTQI+ programming that includes programs like Pivot and Do You Mind, which is a newer mental health leadership development intervention. Next slide, please. So this slide just includes some media clippings and images from around the time that CBRC was first formed, which was in response to the lack of community engagement in HIV prevention research in BC in the late 1990s. And of course, this was a time where governments and academic research institutions were actively ignoring gay men, despite the fact that we were representing the lion's share of new infections. And at the same time, studies were being published that essentially blamed and scapegoated gay men for rising HIV rates without at all working to understand the social factors and contexts that were underlying this heightened or greater vulnerability among gay, bi, queer, and men who have sex with men. So, of course, our communities were pushing back against these narratives and the failure to engage the most affected communities when it came to HIV. And CBRC was an organization that was formed out of this very specific struggle in order to position gay men and other affected communities much more meaningfully. So we were in a position to lead our own research and interventions. Next slide, please. So enter the Sex Now survey, which was proposed as a way of addressing some of the critical gaps that I just referred to. the lack of community-led or community-based research on HIV and gay men. So this slide shows some pictures from our earliest field-based surveys, which started at Pride festivals across BC in 2002. This was work that was spearheaded by the organization's founders, Rick Marchand and Terry Tressler. Really working with diverse community groups across the province to organize these research endeavors at these Pride festivals. So for the first few years, this was in person in BC. And in 2007, just with the advent of the internet and sort of leveraging the possibilities of what that could mean in terms of producing a national data set, Sex Now moved online. While we were still sort of focused on collecting and analyzing the data with a BC focus, because up until during that time, CBRC was still a provincial BC-based organization. But at the same time, we were, beginning to move into a national sort of mandate for the survey, given the fact that we knew that there was a need for this data from across the country, and with the possibilities with an online survey, it really felt like it was change that needed to be done. So now, Sex Now is it's the principal community-based research project that is administered by CBRC, and the largest and longest running survey of LGBTQ men's health, which has really provided an essential source of data on the health of our communities across the country. Next slide, please. So as I just mentioned, it is the largest survey of LGBTQ health in this country. And one of the nice things about having a large sample size is that it does allow us to show some common experiences among diverse LGBTQ, and using this data to advocate for some policy changes that we need to see. And therefore providing a really critical source of data on LGBTQ health. And it's important to know that this is data that governments aren't collecting, that a lot of academics are not collecting, and so it's really helping to fill this knowledge and evidence gap in terms of what's impacting our health and well-being. I mentioned earlier, this is the longest running survey of LGBTQ health in Canada. So it's been running our first BC-based surveys began in 2002. It does provide some insights into some trends between years, so including even changes during before and where we're at now with the pandemic. Although it is important to note that you just need to be careful about sort of making year-to-year comparisons. The Sex Now survey is a cross-sectional study, meaning that the folks who answer the survey each year are not necessarily the same one. So i.e. it's not a longitudinal study. So we can't actually make direct comparisons across different data sets with a ton of confidence. And this is especially the case for the in-person versus the online data collection, since we know that we really do see different samples of people who are participating in the survey in person through like a paper questionnaire versus those that are doing it online. So just something to keep in mind. This just basically means that we can't be sure if the changes that are occurring due to developments over time or are due to the changing nature of the populations that we're collecting this data from. So just a couple things to keep in mind, but that being said, we still do see some strong trends across the data sets. And I think a very important example that we see around this is around PrEP knowledge and uptake. But I think that that's something that seems logical given sort of the timeline for implementation of PrEP in Canada and the increased availability and awareness of that over time. Okay, so next slide, please. Okay, I just want to talk about a few limitations of Sex Now. I think one of the most important ones, and of course very relevant for today's discussion, is just the fact that it is an overrepresentation of white participants. So in 2018, we had 73.9% who self-identified as white. That increased up to 83.5% in the last 2020 survey. We do see a relatively small number of ACB participants, about 4 to 3%. And really, like, I think related to what I was saying earlier in the last slide, having a smaller sample size can make it really hard to do some focused and specific analyses. So really, I think size does matter when it comes to quantitative research. And in addition to ACB participants, we also do see a small number of other BIPOC participants. So this issue is not specific to ACB communities alone. I think this is a need across the survey to really work intentionally to increase our engagement of BIPOC communities and peoples. And that's probably going to take a lot of work in terms of doing some relationship building and active promotion within diverse communities. Up until now, Sex Now has only really been available in English and French. We have this year, a really exciting development is that we have managed to add some new languages. So the current Sex Now survey, which is available right now, is available in Spanish, Punjabi, and traditional and simplified Chinese, which is a big first for us at CBRC, and we're hoping to be able to continue that going forward. The last limitation, of course, and this can be said about a lot of surveys, is that that Sex Now is not representative of all of GBT2Q people. So it's unlikely to represent some GBT2Q subpopulations particularly well. And one example might be newcomers and refugees. And that conversely, or related to that, we do have a overrepresentation of folks who are more out, more educated, and have a higher economic status. So, that reflecting just some of the biases in the ways in which we're able to collect this data. And I think keeping some of those limitations in mind is important. Next slide, please. So this slide just shows, it's a screenshot of the RStats dashboard, which is available at cbrc.net/rstats. And I want to acknowledge a couple people in this slide. The first is Kiffer Card, who was a former CBRC postdoctoral fellow, who working with the principal investigator for Sex Now and the research team worked to develop this, what we refer to as like a data democratization sort of project and platform, making the data from Sex Now more available and just broadly accessible. So big shout out to Kiffer for all of his important work in getting the RStats dashboard established. I also want to acknowledge Ryusuke from the research team, who has done a lot of work to update the RStats database that powers the dashboard. So I want to mention that the dashboard currently contains data from our 4 recent versions of Sex Now. So 2015, 2019, and 2020, the in-person survey that was done at Pride festivals in 2018, and that will be adding future Sex Now data into the dashboard. We've also very recently updated our stats to include the data from the 2020 COVID survey that we did last summer. And I want to thank Ryusuke in particular for helping to prepare the slides and the data that is being discussed today, which most of it was pulled out of the dashboard itself. So next slide, please. So I mentioned this earlier, but I just want to flag and remind folks that Sex Now 2021 is active right now. We are still looking for participants. So definitely want to encourage everyone to please fill out the survey if you haven't already. Many of you probably know, but one of the features with this year's Sex Now is that it includes an optional HIV self-testing component. So folks are welcome to opt in to receiving up to 3 HIV self-test kits for free through the study. And this could be for you, but you can also share it with your friends, your partners, people that you know. And certainly, with everything that we've been going through as a result of this pandemic, getting easier access to HIV testing is definitely a good thing. And so if you haven't yet participated, the survey will be open until the end of August. So the survey does close by then. So please do check out the link at the bottom of the slide, complete the survey, order some test kits, and thank you for your help in also contributing to the data collection as well, which, as we'll go through later on, is more data, the better, in terms of being able to power analyses and discussions like these. Next slide, please. Okay, just a last slide before I hand it back over to Robert. So just a couple points. The 2019 and 2020 surveys were online, while the 2018 survey was held in person. So it's just important to keep in mind that it was a different set of respondents who participated in each cycle of the surveys. The quote unquote ACB participants refer to respondents who identified themselves as African, Caribbean, or Black, while quote unquote not ACB participants refer to respondents who did not identify themselves as African, Caribbean, or Black. Okay, different questions were asked in 2018, 2019, and 2020. So some variables are unfortunately unavailable in a given year. And the Ontario data set does include participants in Ontario from all years. Okay, and with that, I'm going to pass it back over to you, Robert.
Thank you, Michael. Yeah, so we've answered the who we are, we answered why we're here, and so now we're going to get into what we know. So first and foremost, let's introduce these amazing panelists who I know personally and professionally, and really excited to be here with. Before I do, I just want to give also a quick disclaimer, and I should have said this at the beginning, but a lot of acronyms and terminology being thrown around. And so, of course, for those who are not familiar, but ACB in reference to African, Caribbean, and Black. In terms of the BGMN, we tend to use same gender loving in preference to MSM, or men who have sex with men. And we also, of course, have the GBT2QS+ acronym, gay, bi, trans, two-spirit, and queer. And so we might use some of those terms interchangeably, but in reference to the BGMN, ACB, SGL is kind of the acronym that we're grounded in, even though we might use some of that terminology interchangeably. So enough from me. One personal agenda I had about this is I don't like reading people's bios. So I do want to introduce our amazing panelists, Kymani Montgomery, Jermane Hall, and Dr. Lance McCready. And I really want them to let them introduce themselves in the space, how they like to present themselves in this space, and also just kind of give us a glimpse of what was your interest in being part of this panel. And so first I'm going to turn the floor over to Kymani Montgomery. And yeah.
Hello, everybody. My name is Kymani Montgomery. I use he, him pronouns. Professionally, I am the programs manager for the 10 Oaks Project. We are a small NGO based in Ottawa that provides services and programs for 2 LGBTQ+ children and youth from queer families, queer communities, and queer identities. Some of the programs that we run are Camp Lifting Leaves, Camp 10 Oaks, Project Acorn, Families in Transition, Trans Children and Youth Swim Night, and Shaping Parenthood. I'm very excited to be a part of this discussion. And one reason why I am really interested in being part of this is because I am extremely interested in collecting data, particularly around marginalized groups. Because if we don't collect data around our identities, then we don't count and we don't matter to a lot of folks. And so we have to be able to have the numbers to provide proof to show people. So if you don't count people, people don't count. So I'm really excited to be a part of this discussion. Thank you.
Thanks, Kymani, and thanks for taking the time to be with us. Nice. So next up is Lance McCready.
Good afternoon. I guess that's what it is where we're coming from me, but it might be, I guess it'll be afternoon for most folks, or maybe the evening. Yeah, I guess professionally, as Kymani sort of started out, I'm an associate professor in the Department of Leadership, Higher and Adult Education at the University of Toronto. And I'm also director of the Transitional Year Program, which is one of the oldest university access, post-secondary or university access programs in the country. It was established in the 1970s, specifically to improve the pathways for non-traditional adult learners, Black, Indigenous learners in particular, to University of Toronto. I'm also sort of a long time community health educator and advocate. Started when I graduated from college in 1990, was one of the first youth board members at Black Coalition for AIDS Prevention, but it's Gay Men of African Descent in New York City. So, you know, I always have loved that work, and I've sort of continued that work of doing community health education, organizing, social support, cultural productions with Black gay men in Atlanta with the Second Sunday Group, and in California, the Bay Area, with the Black Gay Letters and Arts Movement, workshops at Patrick's Cabaret in Minneapolis, and then here in Toronto with Black Coalition for AIDS Prevention. So this work is always near and dear to my heart. I think it will always be a part of my life. And I've been very curious about all the data conversations here in Canada and Toronto, and, you know, this disaggregating data, sort of race-based data, also trying to use these surveys to get some population-based data for same gender loving Black men. So this is sort of a beginning conversation for me, and like, well, what do we know? Like, that's why it's titled that, and to see where we're gonna take it from here. So thanks so much for inviting me, Robert, to be a part of this.
Oh, it's our pleasure. Thank you, Lance. And last but certainly not least, Jermane Hall.
Hello, everyone. I'm Jermane Hall. My pronouns are he, him. I am the admin resource for Black Gay Men Network of Ontario. I'm particularly interested in this conversation, mostly from a personal standpoint, as someone who came here as a refugee, and with my own lived experience being so intersectional, it was interesting for me to be a part of a conversation about Black women when it comes to mental health and substance use. You know, I have friends who have struggled with substance use. I myself have had issues with mental health and wellness, which I feel like on some level everyone else does, but we never have this conversation. Not never, but rarely have I seen these in-depth conversations as it relates to Black same gender loving men. And I feel honored to be a part of the conversation.
Thank you, Jermane. We're honored to have you. And I know Michael shared a little bit about my bio, but I just wanted to, you know, my interest in this conversation from being a nurse and it's my job to have evidence-based practice to share with my clients. And so what I love most about research is reading it and then applying it to improve outcomes. And so I feel oftentimes, especially being invested in a lot of Black and or LGBTQ plus and or HIV related care since I moved to Canada, I feel oftentimes the conversations are overtaken by the issues with research, how we're often left out. And it's same as Jermane, just excited to have a conversation about what it is that we know, as imperfect as it is, and ways to improve. So a lot of information to cover. Of course, time is of the essence. So we're going to just jump right into the data. So we're going to first look at some demographics, and we're going to look at some things around sexual orientation and identity. Talk a little bit about those issues, sexual health and pleasure, and then we have a little bit of data as it relates to substance use. So we have our panelist slide, and when we bring the next slide up, here we see participant self-reported racial and ethnic identities. First slide that we're seeing is national data as it relates to the surveys from 2018, 2019, and 2020. And here we see first ACB folks who are making up 4% and then last 3% of data population. And we set in comparison to those who identify as white, Asian, Indigenous, Latino, Middle Eastern, South Asian, and other. So of course, we've had conversations around these slides as practice. And so there were some interesting reactions when we first presented these slides. And then when we move into our next slide, here we have a racial breakdown of Ontario for all years. Of course, this would be from 2015 to 2020. And here we see African and Caribbean and Black folks making up 6% of participants in the study. And then still again, white people overrepresented. And of course, rest of our BIPOC brethren. So I noted Lance had a really strong reaction to when we first talked about these slides. So I want to kind of lob the question to him first in reference to when you see this data, how is it reflective of the ACB population that you're familiar with or you have experience with since living in Canada?
Yeah, I think what it sort of reflects, my reaction sort of reflects, I was like, oh, I guess I live in a little bit of a bubble because my bubble is not just 6% African Caribbean Black. And so I think depending on where you live, like where I live in Toronto, I see more ACB folk. And even in the context I work in the transitional year program at University of Toronto, I see more. So basically 6% even, and this is higher than the 4% nationally, it seems low. But then I guess when you compare it to the overall stats, population stats of Canada, I guess it's not too far off. Is that right? Is that how the way to understand that?
Yeah, so, certainly in Kymani and Jermane, kind of the same question. And do these numbers represent what you're familiar with and or what you know about census data in terms of, relation to Canada?
I feel like I've never, every time I hear about census data about Black folks in Canada, there's never no one can pinpoint a number. It's always hovering around 3 to 5%. But like Lance, so much of my friends are Black that number always seems foreign to me. But then I went to Winnipeg once. There were all white people everywhere and barely any Black people. So I was like, okay, so Toronto, it's a reminder that Toronto is not Canada, basically.
Good point. Yeah, and just very briefly, so Black people make up roughly 3.5% of Canadians' population, 1.1 million. Majority of Black people live in Toronto, Montreal, and Ottawa in that order. Toronto's the most populated city by amount. Ottawa is the most populated city by percentage. So living here in Ottawa, Black people make up 7% of the city's population. And so, yeah, it certainly depends on where you're at, but certainly Canada is a very white country, of course by design, but.
But, you know, also I think when you're interacting in the larger sort of, you know, to us LGBTQIA plus or sort of gay, bi, men's community, a lot of times it can feel like 6%. or it can feel like 5%. So depending on which kinds of activities that you're doing, like sometimes depending on when we did socialize in person, depending on what sort of bar or club you went to, it could feel very 5%, right? So, you know, depending on what community events you go to, it can feel very 5%. Because it doesn't feel like that if you go to a ball or in the ballroom community, it doesn't feel like 5%. It feels like, you know, much more than that. So it all depends, you know, your perspective of like which event you're going to, you know, as Jermane said, what part of the country you're in, like which city. So it's interesting to have some data to then reflect on all of those things.
Yeah, for certain.
I could chime in just anecdotally, like geography does make a huge difference. I lived in Edmonton for a little while and saw a handful of Black folks, and like 2 of them I knew. And so just to show you how small the Black population is in Canada, and yeah, very, very concentrated in Montreal and like Toronto. And so like if you don't live in those areas, you feel that low percentage makes sense.
Yeah, for sure. So for sake of time, I'm just going to move us along to our next 2 slides. And so here we have some breakdown about gender identity for folks who responded to the survey. So the first one that we see here is around who identified as man, woman, or neither. Being a woman excludes you from taking part of the Sex Now survey. So that's why there's no data on that. But we do see a majority of Black men who respond to the survey identify as cis or trans. And then an interesting note is that 6% of ACB participants nationally identified as trans. And so when we go to our next slide, and we see comparisons to all years in comparison to non-ACB folks, we see a similar trend. The majority of folks who are cis or trans and identify as men make up a majority of participants in the survey, and the women again. And then here we see where those numbers around trans identity kind of come into light, because we see that ACB men are slightly more likely to identify as trans and or neither. And so kind of opening up the discussion around this panel to Kymani first, you were kind of the first to note these differences around gender identity and the differences in ACB folks. So just wanted to give you an opportunity to kind of speak to that and your observations.
Yeah, I found it really interesting that a lot of folks decided to describe their gender as neither, just because I know a lot of young ACB folks who are identifying as non-binary more and more because they no longer feel as though the categories of man or woman ever can really describe them because of white supremacy. So like Black women can never really be seen as women in so many different ways because of the way that misogynoir operates. And I know a lot of other Black folks who feel the same way. And so I find that like very interesting that more ACB folks are deciding not to describe their gender as man or woman. And honestly, a little bit happy with those stats because it really just shows how Black and ACB folks are consistently pushing boundaries and trying to dismantle the gender binary. So I'm really happy with those stats.
Yeah, for sure. I think about too around programming and the nuances involved of wording. I mean, even thinking about the BGMN's history, we had a very long discussion about our name, Black Gay Men's Network, of like, what's involved in that? How do we keep that name, but still try to be as inclusive as possible? How intergenerational dialogues impacted that name. Yeah, anyone else in terms of thoughts around gender identity? In the slides we have here?
Just that there, I think that there are a lot of folks in our community, and even a lot of men or people that identify as queer and might be cisgender, that just don't like gender binaries and want to challenge that. And I think we need space to talk about that, but that could sometimes, and to learn from each other about that, because I think that that continues to be a controversial issue.
Definitely. Thanks for those comments. And I think when we move into the next slides around sexual identity or sexual orientation, excuse me, we'll expand a little bit more on these themes. If we can get the next slides up. So here we see sexual orientation as it's marked on the Sex Now survey. And this is for ACB men for all years. And so majority, 3/4 approximately identify as gay. We have 27% who identify as bi, 19% as queer, and 6% as straight. And Michael, correct me if I'm wrong, but as I understand this slide as well, the way the CBRC asked the question is that it includes cis or trans identity on a separate question. Sexual orientation and gender identity are kept separate on the survey. So then when we go to the comparison of national data on the next slide, we see this in comparison, because one thing that really popped out to me is that, almost 20% of Black men identifying as queer. And so when we look at the Ontario statistics for all participants, we see as Black men, we're kind of even keel with other identities, with the exception of queer, almost 2 to 1 more likely to identify and have a queer identity. So Jermane, I wanted to start off with you by asking you, what significance do you think that holds in terms of more Black men identifying as queer?
I think it's in line with what Kymani said in terms of not identifying with the gender binary. I do think queerness is so expansive in its nature that a lot of people, that even if you at some point had identified as gay or lesbian, then came the concept of queerness that gave you more room to see yourself as not just something sexual. So I think that it decentralizes sex. So they're often, even though most times I identify as a gay man, there are times when I feel like that feels limiting and doesn't represent who I am as a whole. And I feel like queer, identifying as queer does that. And stepping away from what feels like another binary, gay, straight. Queerness gives us that opportunity to express ourselves in different ways. That's not so focused on how we have sex.
Good point. Anyone else to add?
I think also language and labels are often just about like solidarity and finding safety. And so folks who identify as queer are giving a little bit more space and saying, hey, identify in a way that's not as narrow or as some people think. And so it just provides a little bit more space, just like Jermane was saying. And so I think we have to provide space for people to constantly change their labels and update their labels if they want to. And so, yeah, I love folks identifying as queer.
For sure. And then, Vance, I was reflecting back on the conversation we had in preparation, you made a really good point in terms of how age impacts identity in terms around conversations. And, you know, just wanted to give you a chance to speak to that a little bit if you'd like.
Yeah, I just think that, I think Kymani sort of alluded to that too, just that there's just a lot of younger people that prefer queer. I think that, I mean, we didn't really, like, when I was in my 20s, you know, at, you know, gay men of African descent, we doing a lot of our community education. We talked a lot more about bisexuality and gay identity, but we weren't talking about queer as a label. And that was still at the time when a lot of people thought that queer was sort of anti-Black and that it wasn't sort of appropriate. But it's like now when I've done some sort of research or inquiry projects, I know with a lot of young women, you know, cis and trans, like they don't want to talk about like, or use the label lesbian at all. It's, you know, it's sort of queer women or Black queer women. So, you know, it's interesting to think that maybe there's been even a shift, a generational shift in this conversation, and there will continue to be sort of different sort of interventions and perspectives around this according to generation. But yeah, now I don't even blink an eye about that. I was just thinking, but now that's not even I think you would get a funny look if somebody tried to say really like queer is anti-Black. Like that's not really what we're talking about.
Yeah, and a lot of themes, you know, a lot of personal points that I'll make throughout this thing, and I think this is a key point to hit on it, is like, it also speaks back to that Black people, Black queer people, Black gay men, like we've been critiquing our sexuality and our identity for a really long time, right? It's not a new notion. It's just that, you know, white people all of a sudden have discovered that these are conversations that we've been having all along. Yeah, so next we're going to get into the last of the demographic slides. I'm going to move us along here to, so here we have some demographic information as in relation to ACB folks nationally, 2018, 2019, 2020, where we see as to was Canadian born. So we see that range from 51 to almost 60%. Coming out about sexual orientation, we see those maintaining fairly high numbers in the mid-90s. Interesting question here about who has enough extra money. We see that range from 68 down to 58, and then that goes back up in 2020 to 76%. And then in relation to education, when asked about, do you have more than high school education, this question was only asked in 2019, and we see where 3/4 of Black gay men answered this as saying yes. And then we'll move on to the next slide to show the comparison. And so we see this comparison for Ontario, gay men for all years. And we see a huge jump, right? We see this Canadian born for ACB men significantly less likely to be born in Canada, more likely to be out, significantly less likely to have enough for extra money, and slightly lower when it comes to high school education. So obviously these are really rich slides, but I'm going to start off with Kymani with this specific question. You had some really interesting comments around extra income and how you see that income in 2020, but also the comparisons between Black and non-Black folks. I just wanted to have you speak to that first.
Yeah, I find it super interesting that considering that we're in a pandemic, and that the pandemic started in 2020, that folks feel as though they have more or enough income or money. I hope that is due to social assistance or just people in better economic standpoints. And hopefully that can continue and people feel that way. So it'd be interesting comparing the data to the next survey that will happen. So yeah, I just think that's a really interesting point, that folks feel as though they have enough to support themselves or extra money.
Yeah. And just kind of a general question, maybe we'll start off with Jermane answering this around, like, are we surprised by the high amount of ACB men who report being out about their sexual orientation?
I'm not surprised. I think I'm not surprised because as someone who came here as a refugee, I made that decision to center myself and my own happiness. And I know that that's the case for a lot of ACB folks who came here from different countries as refugees. You know, there's that, it's a very radical step to take that a lot of people do take that I know. It's very anecdotal, but I'm not surprised because I know that the lengths at which a lot of my friends went through to get to Canada so that they can live their most authentic lives. So I'm guessing that's the case for most Black folks. At some point, you just want to live your life for you.
Yeah, thanks for sharing, Jermane. And Lance, any additional thoughts in relation to either foreign status, sexual orientation, income?
No, there's a comment in the chat about the coming out about sexual orientation. Even that question or category is interesting. It sort of flies in the face of sort of the down low conversation that Oprah perpetuated, and that there was a lot of, you know, those of us in the States who were reading like Terry McMillan and Oprah Winfrey and, you know, Keith Boykin, like there was a lot of stuff and a lot of media attention given to Black men in particular who are not sort of out about their queerness or about their non-heterosexuality. But I don't know, I think Jermane also raises a good point, and that maybe there's some intersection between, you know, not being Canadian born or sort of coming here as a refugee or as an immigrant, and sort of part of that whole reason for doing that is to sort of live more open, authentic, queer life. So, I mean, it's interesting to think about. Also, I'm not really sure what some of the dynamics could be with people who are not ACB, or why that would be more amongst, because even amongst people who are not ACB, I mean, you could have other sort of, you know, East Asian, South Asian, indigenous people who are not Black, who maybe are, but are also slightly less in aggregate, less likely to be out about their sexual orientation. So that's interesting to think about, specifically about Blackness, or sort of identifying as African Caribbean and or Black, and how that might be related to deciding to be out about your queerness or queer sexual orientation.
Yeah.
Can I add another piece, Robert?
Yes, very quickly.
A lot of people, a lot of Caribbean folks or folks who immigrate here, the way in which we conceptualize being out is different from like the North American, you know, sitting your family down and having a conversation with them. For a lot of people, out simply means just living your life the way you want to, and you're not hiding it. So maybe it could be just a difference in, you know, how people conceptualize coming out.
Thank you for highlighting that too. Yeah, because we're talking about some very strong North American ideals, right? And obviously, like, you know, it speaks for itself. It's a different narrative, you know, what it's like immigrating to a country versus claiming refugee status versus what it's like being born somewhere. And that creates all different levels of hierarchy and connection to family and community. So all good points. I'm going to move us along for sake of time. So next we are going to look at some sexual health and behavior questions. And I just wanted to Sexual health and pleasure is one of the main pillars that the BGMN is focused on. And so how we've kind of defined this for ourselves as Black gay men through those ACB dialogue discussions that I mentioned in our introduction. And I'm just going to paraphrase here what's from our website is that we want sexual health needs that is as broad as dynamic as we are. We want sexual health literacy that needs to come from a holistic and wellness perspective. We don't want to just talk about HIV and STI prevention, but we want to talk about relationships, pleasure, and intimacy. And of course, there's some really main challenges with that because as I highlighted in the drawing that Alucia created for us is that there's a lens of HIV that I feel is constantly around Black gay men and how do we speak to that and get what we need. So with that being said, and looking at some sexual health and behavior data from the ACB folks that we know from Sex Now. So this is for ACB men nationally through all 3 years. We see a really interesting dip here when it comes to condomless anal sex, and this is reported in the last 6 months. So we can see that go from 20 to almost 50%, and then we see a decrease in 2020. This HIRI score, which I'm going to have Michael speak to very quickly at the end of the slide. That's related to sexual health knowledge that the CBRC gauged. And it's in relation to knowledge of you equals you. So we see Black gay men really increase from 2018 to 2019. That question wasn't asked in 2020, from 67 to 82. We see knowledge of PrEP remain really high. Interesting stark contrast, we see HIV testing, STI testing dipping down to 30%. This is a trend downward, but a strong, steep downward. And then we see reporting of HIV remaining around 12%. So in just being focused on the data that ACB men present, first, Michael, can you very quickly describe the HIRI score?
So the HIRI score, I think, actually refers to PrEP. And so it's the HIV. Basically, it's a risk, HIV infection risk index. So it's a quantitative measure that's used to assess, whether or not someone should be a candidate for PrEP. And so I think, like that basically just, I think, refers to a higher score sort of refers to someone being considered a candidate for PrEP. I can't remember off the top of my head what is the threshold that's being considered, but basically involves assigning sort of like a numerical quantitative score to, different things, everything from like your age to, your relationship status, sexual practices, number of partners, that kind of thing.
Sounds good. And we have some comments in the chat. HIV incident risk index and a score less than 10 is a low likelihood of acquiring HIV. So thank you for all, and thank you for explaining that, Michael. We're glad you're here. Such a rich slide. So we kind of have this question for Jermane here for you. So what do you think accounts for such a stark drop in HIV and STI testing when you, from 2020, clearly we had the pandemic involved, but could anything speak to you in that regards?
Yeah, I think the global panini was the major factor. I did the 2021 Sex Now and the COVID version, and one of the questions was whether the pandemic was basically a major barrier for you. And yeah, I wasn't thinking about getting tested when I was, focused on. There are so much other things that took precedence in my life, in other people's lives that I knew, that none of this seemed abnormal to me.
Yeah. And is there anything that's really surprising or not surprising, in terms of this data, Kymani and Lance?
Well, I think that I'm part of a couple of different sort of collectives. Or one is the Investigators, which is also a program that was started by the CBRC, where we do basically community education around doing research into young gay bi men's health. And so I was a mentor as part of this. And so we talk about this sort of thing, the whole sort of, the measures of sexual health and behavior are always, I think there's always conversation about like, how important are they? How much do they sort of link up to what you know about sort of, how and how much and what kind of sex sort of gay, bi, same gender loving men are having. So, and the focus on risk. I do think, as Jermane was saying, that the context of COVID has really raised a lot of questions about testing in general. And it's also for a lot of Black people about just their relationship to the healthcare system, issues of trust, which includes sort of HIV and STI testing. That's part of healthcare, many of those, where you get tested, whether it be a community clinic, a hospital, or a community health center. So I think there was a lot of trust that was sort of broken and called into question in the context of COVID, not having COVID sort of tests available widely, sort of, not necessarily targeting sort of in Canada, sort of Black, Indigenous, and other sort of marginalized sort of groups that are at greater risk for COVID. So and then a lot of people still have questions about the technology of like the vaccines and how they might, be given the history of the way that sort of Black people have been mistreated in the healthcare system and given harmful sort of drugs, whether it be related to sort of pregnancy or teen pregnancy or Tuskegee experiments or syphilis or other things. So I just think there's a lot to unpack.
Yeah.
And we don't know how much this is affected, but at the very least, I think we have to acknowledge that the context really changed in 2020 around testing. That's all that, I guess I would feel comfortable saying. And I also think the numbers, in terms of folks reporting living with HIV, that continues to be low. And I don't know if that, I guess at the very least, you could say you get two really different sort of pictures of that, of how many Black, same gender loving MSM men are living with HIV, depending on what survey and what sort of communities in. It continues to be a challenge for us to sort of do programming and really public work around living with HIV. And so I think that's reflected in this survey, and in the sense that there are sort of really low numbers of men that are either willing to report on a survey that they are living with HIV, or I don't know. Yeah. Even though here, I guess this one is saying still that, it's higher in Ontario. There are more Black men living with HIV, the reporting living with HIV. I still think that is sort of seems to me like a lower number.
Yeah. Yeah, so I wanted to, Kymani, I do have a specific question for you, but I just wanted to move this along a little bit in terms of the comparison data. Of course, this is for Ontario of all years, Black people compared to non-Black people. And so, we see similar numbers around condomless sex, this index score, slightly more knowledgeable about U equals U in PrEP. We see more testing for HIV and STIs in the past year. And this is, of course, for all years. So, of course, be interested in pull apart specific years. And then we see this really stark contrast between living with HIV more than over 1.5 times more likely. Kymani, you had a very interesting reaction to the question about condomless anal sex that I just wanted to give you a chance to speak to.
Yeah, I think we often have a huge fixation as like same gender living folks around like penetrative anal sex. And I think if we're having a discussion around sexual health and behavior, we have to really expand how we see sex. And so we can't just ask, have you had condomless anal sex in the past 6 months? Because some folks might not be having sex in that way. It just limits the way we can view sex, and it just limits our understanding of how people engage in sex and their sexual health. So yeah, I think maybe asking more questions around like, what sort of sex are you engaging in? Because we also know that that's not the only way STIs can be transmitted.
For sure.
So yeah.
I also think back, you know, in terms of the higher amount of Black folks are more likely to thinking about how sexual identity, sexual orientation and gender identity impacts sexual health choices, right? You know, more Black folks are more likely to identify as trans or non-binary, how that also impacts conversations around sex. The one agenda that I had with this slide that I wanted to insert too is, for me, when I see the slide, it just so strongly pushes back on that narrative of Black men of us being, you know, we're always deemed as being risky and risk-taking behaviors. And one thing that we know from data in the from the States that we know for a long time is that Black and Latino men are more likely to participate in less risky activities because of their increased knowledge around HIV and STIs, and you know, really combats that narrative of Black people as just being more sexually deviant or engaging in same sex. And I think the slide helps bring that narrative in a Canadian context. Michael, did you have your hand up?
Yeah, well, I think I just briefly wanted to mention that, like, I think maybe in some respects, the profile has some sort of quote unquote riskier indicators. I think there's a lot of examples of more protective indicators, like around knowledge of U equals U and PrEP. I think those are really like encouraging kinds of distinctions where, yeah, like I think it pushes back against this narrative that, you know, that these prevention strategies and tools are not being taken up by ACB folks. And so I think it's just, you know, interesting to sort of consider these data and how they align with our, you know, preconceived understandings or perceptions of, you know, what's happening.
Yeah. So I'm going to move us along to the next slide. We still have a lot of rich data to share. And so I'm going to move through the healthcare access questions. There's 4 slides here, so I'm going to just kind of group them together. But here we see ACB data for all years. So this is reasons for delayed testing. So we see stress, particularly in 2019, being reported relatively high amongst Black men. We do see language barriers being reported. I do want to bring out a caveat, as Michael said, in the 2020 survey was the first time it was available in languages more than English and French. So that could be impacting in terms of language barriers and how they were reported. And then we
just to clarify, actually the additional languages were just added for the current.
Oh, okay, thank you. That's why you're here, Michael, thank you. But we still see that ACB men have a high percentage of reporting language barriers, and then lack of sensitivity to GBQ health. And then when we move to the next slide, in relation to comparisons, we see where, you know, Black gay men are significantly more likely to report stress as a reason to delays for testing. We do see some language barriers here, and then also high in regards to lack of sensitivity to GBQ health. And then if we can move to the next slide. Here we have some, just for sake of time, I'm grouping these 4 slides, but Here we have some national data around discrimination, and this is amongst Black folks. And so these questions were only asked in 2018 and 2019. And so this is, have you ever experienced discrimination based on, and then we have what's below here, which is HIV status, PrEP status, race, which we see in 2019, 80% of Black men reporting experience discrimination based on race, sexual orientation, trans identity, disability, and then we see about a 50% people saying they're satisfied with connection to queer communities. And then if we go to the next slide, this is the Ontario comparison for all years. And so what really stands out here is that you see, discrimination around race just really outranking all other non-ACB groups. We see discrimination based on sexual orientation. We see it similar to trans identity and disability, and still a slightly less satisfaction with connection to queer communities and compared to non-ACB folks. And so, so one thing that came up in this conversation, Lance, is that you commented about stress and how it seemed kind of vague for the first two slides and in context to Black folks. I just wanted to give you an opportunity to speak to your thoughts that you had around how stress was being measured and how it plays out into these discrimination variables that we're seeing.
Yeah, well, I just think that there's a lot of the sort of theory or conceptual framework that's used around stress in research and HIV research with gay bi men is the minority stress theory, which basically posits that the stress that gay bi men may experience related to sort of different social identities and incidents of discrimination may lead to a higher incidence of HIV. And so, but I think there's a lot less that we know about race-related discrimination and its relationship to, in general, health status, not just HIV. So that's one of the things that I'm thinking about this, but there are also like these other sort of categories, sexual orientation or disability. So I think being, and the whole question of being connected to the larger LGBTQ plus community is an interesting one. I'm not even sure if a survey could capture sort of the dynamics of that amongst Black men, but I was thinking about that. I also want to just go back to something from the previous slides, just that when you think about sort of knowledge or sort of education around sort of U equals U or PrEP or, getting tested, it seems like on the one hand, these sort of health messages that are around, I guess, on the apps or through our agencies or community health centers. On the one hand, it seems like they're having an impact, and that you see like, oh, more Black men are knowledgeable of U equals U, or oh, more Black men are knowledgeable of PrEP. But I always think like, then you have to think, how do we make sense of that in relation to the epi data, the epidemiological data that shows that there is a higher incidence of HIV among sort of Black, gay, bi, sort of same gender loving men. So what does that mean, or what's the story there? And they're coming from different surveys, of course. That's not necessarily from the Sex Now. It's just that you kind of have these very public, healthy epidemiological surveys that show the high incidence, and then you have a community-based sort of research survey that shows sort of like actually an increase, or at least like, if you don't want to say increase, just say like good levels of knowledge of some of these prevention and education. So do these go together? Are we surveying different populations? Like, how do we make sense of that? So that's one of the things I'm still sort of thinking about from the previous slide.
Yeah.
But here, I think it's all about, you know, making sense of this and minority stress. And what do you think? Yeah.
Yeah. And Kymani or Jermane, do you have any thoughts before we move on?
I was wondering about the PrEP status. What does that mean? I know in previous years, whilst a lot more white gay men had access to PrEP, I knew a lot more, you know, Black men who were having difficulty that they wanted PrEP, but because of immigrant status or other things, finances, lack of insurance, they couldn't get access to PrEP. So I'm wondering if maybe that uptake of people getting more access to PrEP now is impacting the HIV rates amongst Black folks.
You know, if we can be more knowledgeable about it, but if we don't have access to it, we're not getting prescribed it, you know, like it's not, knowing about PrEP is not going to give me the same benefit of actually taking it. And really overlaps with a lot of what we're talking about in terms of discrimination, how that impacts stress and how that impacts our health. So we're going to move on to the next slide. So we just have 2 last slides left for substance use. I just want to note, I want to be respectful of people's times. We might go a few minutes over, but we're just going to address these last 2, share some final thoughts, and hopefully have some questions. And so in relation to the BGMN, our stance on substance use is that we want holistic harm reduction. We want to just focus not on abstinence, but also about pleasure and these middle grounds of harm reduction, how to perform substance use safely, if that's something that we like to do. And so see here we have some ACB data from 2018 to 2020. And CBRC asked about binge drinking, cannabis, crystal meth use, crack use, cocaine use, poppers, and injected drug use. You know, these numbers stand as they own. I just want to point out in that when you look at crack use, you see that number really jump up in 2020. And I think we all had some really deep conversations around crystal meth use. We all know that was higher than we had thought amongst Black gay men. And then when we move to the next slide, we see some comparisons in Ontario to all years. So here we see where binge drinking and cannabis, cocaine use, popper use, injected drug use is on par with everyone else, but we really see this huge spike in crystal meth, 11%, and we see, I think it's significant. It's my own personal opinion, but we do see some more slightly higher reported crack use. So just in relation to substance, we wanted to open up to Jermane first, in that, you know, you had some specific thoughts around substance use and the concept of it, how we contextualize it.
Yeah, I think seeing binge drinking coupled with crack and crystal meth use made me rethink substance use. I mean, I know it's a substance, but for survey purposes, I conceptualize or imagine substance use as those really dangerous substances that are highly addictive. And I didn't put, you know, drinking and cannabis into it because, you know, weed has like a cultural aspect to it as well. So that was the thing that jumped out at me, was just the conceptualization of what is substance. I never thought of poppers as substance in the way that you know, I think about in terms of it, things that are harmful to your that's just what I thought. I didn't think about substance use in such an expansive manner.
I think that's a great question, right? It's like, how do we experience substance use, and how is that different for different communities and different people? And what's considered normal might be problematic for others. So I think that's a really great question to push back on. And Kymani, just give you an opportunity to speak in terms of, is there anything that pops out to you in terms of substance use, either amongst us as Black gay men or in the comparison data?
Yeah, like you, numbers on crystal meth were definitely a surprise, because there's a perception that methamphetamines are more of a white drug. And so it's interesting to see that it's higher with ACB folks. And so, yeah, that definitely stood out to me. And like Jermaine, I didn't know poppers were considered a substance, but knowing that the CDC has recently had recommendations against it, it does make sense. I also find it interesting that cannabis has gone up and binge drinking has gone up. Also considering that during the pandemic, both of these things were considered essential services. The LCBO was open, as well as like the cannabis stores. So does that have an impact on the increase of it if like people just had more access to it?
Yeah, good question. And I just wanted to bring out too, in terms of crystal meth, it's interesting because I think we were all kind of taken aback by the numbers, but my work with harm reduction here in Ontario, of like understanding in Toronto, there's a group of community of Black men who are into party and play or use crystal meth to enjoy sex, but only with other Black men, versus my experience in Ottawa, in which it's usually Black men are invited to spaces, but on a limited basis. So the Black men who I know who are involved in PNP in Ottawa are usually the only Black person at those parties. So just thinking about the sexual racism that's involved with these drugs and how it becomes sometimes even capital amongst Black people, and just how it's viewed. And once again, just kind of depends on where you're at. I want to thank everyone for such a rich discussion. I know that we have more thoughts, but it's already 5:27. So like I said, I do want to be respectful of people's times. I did check in with our behind the scenes person. So we're okay to take up a few extra minutes, 10, 15 minutes. So I just want to give all the panelists to very quickly give their final thoughts and how they thought about being part of the discussion, and also give some room for questions. So Lance, how you feeling at the end of this discussion?
Oh my gosh. You know what I'm thinking? I'm ending this. I'm really glad that we participated, and I really appreciate the work, your works, CBRC's work, Michael's work, Jermane and Kymani. So it's so important that we create spaces for dialogue. Mm-hmm. That is just key. We need to keep on that, and so that's what I'm thinking coming out of this. So like, for one thing, I was like, we just really need to find a way and just create some safe spaces for dialogue about sort of Black gay men and crystal meth use. Or I think we all, the funny thing, with preparation for this, we were like, do Black men use poppers outside of porn? That was my favorite. We were like, do we know? Like, what's going on? So we just need some safer spaces about to dialogue about substance use and some of this stuff, about more general about our health, but not just always about risk and HIV. It's just about, just about our own well-being and what's working, what's not working, that sort of stuff. So thanks for being a part. I appreciate being asked to be a part of this.
Yeah, thank you, Lance. Kymani, how are you feeling about leaving the space?
Thankful. Thankful to everyone who participated. Thank you for inviting me. And just like very interested in seeing more race-based data collected in Canada, because that's often the excuse to why we can't do certain things, because like we just don't have the numbers. So I love the fact that there's more information being collected, because we need to have this data, unfortunately, to have leverage to get what we need and get the resources that we need. So yeah, thankful for being invited into this space, and thank you for having access to this information. So, yeah.
Thank you, Kymani. And Jermane?
I feel really great being a part of this conversation. Mostly because I have a very contentious relationship with quantitative data.
I think we all do.
Right? Sometimes they feel so shallow, but like through these conversations and making sense of it from like an intersectional lens, an intergenerational lens, it feels more real and more, like I feel like I have more connection to the data. Know that, you know, we speak about it, it's such a communal space.
Can I say just one more thing related to that? It's just that I'm really hopeful that more of us can engage in the process of even sort of constructing questions for surveys like this, as well as developing ways of getting it out and sort of making it accessible in ways that make sense to us and sort of Black men in our communities. Like some of that might be through Pride, some of that might be online, but there might be other ways, other hybrid ways that we haven't thought about yet or we haven't put into place yet. So I think, you know, this quantitative stuff isn't as bad, especially if you can feel like you have agency in creating the questions that go on the survey, and then being a part of getting something out that you feel good at that actually measures something that you think is important.
Yeah.
So.
Thank you, everyone, for your final comments. Really amazing. And so we do have one quick question, which was, what question do the panelists wish was included in the survey?
I can go first.
Yeah, go ahead.
I think there was more questions around sexual pleasure. Because like you mentioned before, Robert, there's often such an emphasis on risky behavior in HIV when it comes to ACB folks. And so I wish we can have a better understanding of what does sex look like for us? What does pleasure look like for us? Because when we only get that one view or that one narrative, it becomes everything. And so we have to really understand that we're so much more than just like this risky behavior, and you know, we know things about HIV, but like we need to have more information about like what does sex look like for our community, our communities. So yeah, more questions around pleasure.
Thanks. Anyone else?
Just to be fair to CBRC, when you do take the actual survey, there's quite a bit. Well, maybe it's just this year, but there's quite a bit more questions on sexual pleasure. Not to get too expressive, but they even ask about fisting and stuff. But when you're answering it, it doesn't feel like you're being asked about pleasure. I don't know if it's like an internal judgment, but it feels like,
well, it could, yeah. I was thinking about this. Oh, okay. So what's the difference between, or how do you phrase a question that gets at like the pleasure in certain sex acts rather than just the sexual behavior? So you could just say, do you do fisting? And there, that feels like, oh, I'm answering a question about a sexual behavior, but it's not the same thing as the sort of the nuance, or do you like fisting, or do you like, or this, so I think I was thinking about the same thing.
Yeah, great questions. And we did have another question which was answered in the chat, which was about ethnic and racial identity. Were folks able to answer more than one category? And the answer is yes. The CBRC allows you to check more than one box in terms of how you want to identify it as a racial ethnic category. So
I think that question was actually about sexual orientation.
Okay.
And whether or not you could select, but the same logic applies. Like people can select multiple sexual identities in that question.
Thanks. So thanks. And so before we say our thank yous and goodbyes, I just, in terms of my final thought is that, first of all, thank you to our amazing panelists for joining this really rich discussion. I know my heart is warmed. I want to give a really special shout out to the CBRC. The BGMN went to them with this idea and they were more than happy to support us. They gave us all of the data. And so this really was a joint collaboration. And so we know that there's room for improvement in research, but also do the Sex Now survey. The more Black men who do it, the more data that we have to draw on. And this is part of the reason for the webinar as well. Hopefully to, get some more exposure and get some more folks uploaded into the survey. I know I've taken it the last 4 years. And so, and one thing that I want to share about research is that I hope that I'm really excited about research and how it can really inform community care. I know that there's always the variables and make sure you do the evaluation for the survey. We need that information. We know with funders and grants is that there's always, you know, proof of education. How do you value that? But also, as Lance said, is that we need more spaces for conversation. And I'm just going to take a moment to just share about my process about being connected to Keeping It 100, which is a Black women's group we've been running in Ottawa for the last 4 years. And I remember we were talking about mental health, and during that, someone shared that they had started taking PrEP and it improved their mental health. And then there was this really aha moment because in the group, about 8 or 9 people, there were folks who had never heard of PrEP. There were folks who didn't know any Black men taking PrEP. And so it led to this broader conversation. And I know for a fact that folks who are in that group are now on PrEP. And so I think that, you know, all of these variables are important, but at the end of the day, research has to inform what we're doing, and it has to be spaces for a community to take care of one another because we can. And obviously we've shown that with the development of the BGMN and us taking leadership in this conversation. So just wanted to end on that note. And so I just want to give space also to Michael, if there's anything else that you wanted to add.
I just want to say thank you to you, all the panelists, Kymani, Lance, Jermane, Jermane and Robert especially. It was a privilege to work with you in organizing the session. I think the last thing I want to say is, like, you know, if folks like today's event and want us to do more of this kind of thing, more of these kinds of collaborative, informal spaces to unpack data, like, just let us know, you know, fill out the evaluation survey, drop us a line. Yeah, this was a bit of an experiment, and, you know, again, just want to thank Robert in particular and Jermane for coming to us with the idea. It was a fantastic collaboration from our point of view, and we'd love to support more of this kind of work together. So thank you.
Yeah, for sure. So make sure you fill out the evaluation. We'd love to come back and bring more information, expand the conversation, share our ideas as Black men with the CBRC and how they can improve. And you know, when we make the world better for ourselves, we make it also better for other people. So on that note, drink water, take your meds, call somebody, tell them you love them. Thank you so much for joining What We Know. It's collaboration with BGMN and the CBRC. We want you to be well. Please make sure you check out the BGM's website. We are hoping to launch a steering committee soon. So if you want to get involved in that, don't hesitate to reach out. Make sure you follow CBRC. .net, their website. They're on all social medias as well as ours. Make sure you take your Sex Now survey. The more data we have, the more that can enrich these conversations. And that's a wrap from me.
Thank you.
Thanks, Robert.
Take care, everyone.